Thank you for joining our November information exchange meeting on health and care services during the festive period. Our guest speakers today are Rosalia Enti, Director of Medicine Management in City and Hackney City's Clinical Commissioning Group, and Jennifer Waterfield from City and Hackney Clinical Commissioning Group Pharmacy team. They will give us information on how to order repeat prescription during the festive period and how to make the best use of our local pharmacies. Later on, we will have Clara Rutter, who is the program lead for urgent care in City and Hackney, to talk about out of hours GP services during the festive period. Then I will give the word to Rosalia and Jen now.
Thank you. It's really good to be with you today. My name is Jen Waterfield and I'm a practice support pharmacist in City and Hackney. Can everyone see those slides okay? So I'm going to spend a bit of time today just giving you some information so that you can make the most out of your medicines and your local community pharmacy. And I'm also going to ask you if you can partner with us on doing some things which will help make the NHS work best for us all. So I'll get started. So some good news for us all that even during this lockdown and the future tier system that will come into place, we still have access to our medicines and our appliances all during these restrictions. So that is the good news, which means that we don't need to over order on prescriptions. We can order just the normal amount, not before 10 days before it's due, but at some point after that. And we can just request the medicines. If GPs are over prescribing, so prescribing too much, then later on that could lead to supplies around medicines, etc. So if we just carry on doing our normal thing, that will work and will support the NHS. So how is it best to order your repeat medicine? It is brilliant if you can do that online, either using your GP's online tool or the NHS app. Maybe if you are not registered, that's maybe something you could try and do today, register online so you can order your repeat prescriptions online. But for any reason, if that's not possible, then it is fine to also call your practice or call your pharmacy on the telephone. There's different options there. Something else you could do is you could ask your GP about ERD or batch prescriptions. So if you aren't currently on batch prescriptions, but you have regular medicines that don't really change, then it's possible for you to get these ERD batch prescriptions, which means you can just pick up installments from your community pharmacy rather than going back to the GP as frequently for more prescriptions. But that's something you can ask about further if that may be relevant to you. Okay, so what else can you do to help us and help everyone in this whole process of ordering medicines? So as I've said before, if you can order your medicines in good time, that is brilliant, but not before 10 days before they are due. That's the kind of perfect time. And what might happen is you may be given a different brand of the same active ingredient, but if that happens, don't worry, it's just to do with suppliers, etc. So as long as the active ingredient, the main name is the same, that's absolutely fine. There are a couple of particular cases that your GP and pharmacist will know about where you have to have the same brand all the time, but sometimes pharmacies have different supplies of the same medicines. And I'm sure you all wonderful people do this, so just to ask that you would continue to be patient with your community pharmacists and GP practices during this time, and please do remember to ask your community pharmacist anything, any queries you have at all about your medicines, and do ask away. Any question isn't too silly. Okay, so in terms of then, if you've requested your medicine, requested your repeat prescription, then what about actually getting your medicine to you at home? if the NHS has advised that you are clinically extremely vulnerable, or you are self-isolating because you have COVID or symptoms of COVID, or because a member of your household has, then can we ask, wherever possible, please do ask family members, friends, carers, trusted neighbours to collect the medicines for you from the pharmacy and deliver them to you if that is at all possible. Remembering though that if you are self-isolating because you have COVID or you have symptoms, then the other people in your house will also be self-isolating. But if that support is not available in terms of someone picking up medicines for you, then do contact your community pharmacy directly and they will be able to sort out a delivery for you. Okay, so to just reiterate those points. So if you are not clinically extremely vulnerable or self-isolating, then please use family, friends, neighbours to collect medicine for you, because the community pharmacies are exceedingly busy. However, if that is not an option, do speak to your local pharmacy and they will arrange a delivery for you. Okay, so when you think about minor health concerns, so sort of non-serious health concerns, ailments that you have, I'd love you to think either local community pharmacy or NHS website. Both those things have a brilliant source of information for you.
No, not if you can hear. I don't know. Mine is going as well.
Many community pharmacies are open in the evenings and at weekends, and are usually really accessible to people. They're close by, so these are accessible places to get information. I've also put on there the NHS website, and we've put some other websites there where we would recommend the information there, easy to access and might be helpful to you thinking about minor ailments and managing them at home. But if you want any further advice about minor conditions, please do speak to your local community pharmacy. They can recognise and treat minor conditions, they can give you advice, they can recommend medicines that you can buy to relieve symptoms, and then they can signpost you to another healthcare professional if you are needing more help and more treatment with someone else. Okay, so this is another bit of advice. So in an attempt to maybe manage at home any minor conditions, then your GP advises that you stock up on some over-the-counter medicines. So these are medicines that you don't need a GP prescription for, but that you could maybe buy at your community pharmacy, and some of the things you can buy at some shops, just so that you don't have to delay. And if you have a minor ailment at home, then you could start managing the symptoms yourself. So we've put a web link here which gives you information about what medicines you might want to keep at home. And there's also a list here of medicines you might want to think about. For example, something for heartburn, antidiarrheal, something for allergies, simple painkillers like paracetamol and ibuprofen, etc. Another good piece of advice is to keep a first aid kit indoors, and it's good if that has plasters and bandages and a thermometer. Again, these are things you could buy at community pharmacies or maybe some shops. Another tip, this is a money saving tip. So if you are looking to buy a medicine, then always look for the ingredient name. So for example, ibuprofen or paracetamol, rather than a branded name product. So the name with the ingredient on it as the main name, it will certainly not be inferior in any way. It will do exactly the same job, and you will be able to save some money as well. Okay, so I'm just going to briefly mention Health First Pharmacy. So some of you may be familiar with Pharmacy First, which was a previous minor ailment scheme that was around. It now has stopped, and from September this year, Health First Pharmacy started as a local minor ailment scheme. Now, there are similarities to the Pharmacy First scheme, but it is not the same. It's different there's differences in terms of who's eligible, and also in terms of the minor ailments and medicines that can be included. But it is a scheme that if you are unable to afford the cost of some medicine for some minor conditions to manage them, your local City and Hackney pharmacist may be able to support you by giving you the medicine on the NHS. So if you want to find out if you're eligible for that, then do speak to your local community pharmacist. So this is a leaflet that's available about the scheme, which you could pick up at your pharmacy. So in the middle, on the white panel of this slide, it gives you an explanation of who would be eligible for the service. So at the top, it talks about if you are receiving universal credit and your income is at a level where you're eligible for free prescriptions. And then there's a few other indications as well for when you would be eligible. So do have a look at the leaflet, and then you can confirm with your community pharmacy as well. If you were previously registered with Pharmacy First, it isn't sort of an automatic registration on this new scheme. So you would actually have to register for Health First Pharmacy. There's two ways to do that. First of all, you could, your GP practice, you could ask them to email your community pharmacy at their NHS net email address, and that would have your NHS number in it and would confirm that you were registered at that practice. The other way would be to contact or go into your community pharmacy, and they would be able to check that you are registered at a City and Hackney GP practice. If you are going for that option, then do take some form of ID and proof of your eligibility as per the list in the middle of the screen. And this is another simple message. It's just get your vaccines, okay? So some of you may have had a flu vaccine, may have had a pneumococcal vaccine. If you haven't already, it's still not too late. We encourage people to get them at the beginning of autumn, but the flu season carries on till March. So if you are eligible and you haven't had these vaccines, then please do get it. Flu is highly infectious, and in individuals who have underlying health conditions, it can have serious complications. And this year, more than ever, it's vital that we protect ourselves and those around us from flu and get the vaccine if we're entitled to it. We are obviously thinking we want to do all we can to protect the NHS and prevent them from having COVID plus a flu epidemic to manage over this winter season. The uptake of flu vaccines this year is a lot more than it ever has been, which is great, but we know there's still people to get vaccinated and there's still vaccines available. So can I encourage you to do that? The flu vaccine, you can get that at your local pharmacy, and you can also get the pneumococcal vaccine at local pharmacy if you're eligible. So that's for if you're over 65 or any age but have an underlying health condition. A pneumococcal infection can affect anyone, but if you do have an underlying condition or are older, it could lead to a serious illness, and so it is recommended that you also access that vaccine. And just to say that I've talked about some of the things community pharmacies do, but what we've been realising over the last few weeks is that while talking to our community pharmacy colleagues and patients and residents, that local community pharmacies provide a whole range of pharmacy services, and that is true of City and Hackney community pharmacies. Some are services that happen across every pharmacy, some are specific to a few pharmacies. So I would encourage to have a look online and speak to your community pharmacy to see what things they can offer you. There's weight management services, there's sexual health services, smoking cessation services, medicines use review services. There's all sorts of different services going on from these pharmacies that you may want to access at different times as relevant and helpful to you. Okay, this is just my last slide just now, but it was just to mention that today is the last week of World Antibiotics Week. We've had a focus thinking about antibiotics this last week. So antibiotics are wonderful, they're a wonderful invention, but they don't work against COVID, they don't work against coughs, and they don't work against most they don't work against colds. They don't work against most coughs, sore throats, or earaches. If antibiotics are used in the wrong way, so prescribed when they shouldn't be, or taken not as advised, then we can contribute to increasing harmful bacteria, which then won't have antibiotics to kill them. So that what that means is that we could potentially putting ourselves and our loved ones at risk from getting a more serious infection or a longer illness that then can't be treated with an antibiotic. Antibiotics can also cause side effects such as feeling sick, diarrhea, and thrush. So they are wonderful things when they are prescribed well and taken as prescribed. And just a reminder that good hygiene is essential in reducing the risk of spread of infections, just as we are remembering in the COVID environment we're living in. There's something that you can do here at the bottom. Patients as well as healthcare professionals are invited to choose their antibiotic guardian pledge. So I think you will get these slides sent round to you. There's you can click at the bottom here on antibiotic guardian, and you can pledge to be a guardian of antibiotics, which means that you will be aware of how and when they can be used appropriately, and you will contribute to that. That is the slides I've got. I've got some other information I can share with you. But are there any questions just now? Rosalia, is this leaflet available in pharmacies or online?
Good question. So it should be available online, but I don't have a link to it immediately. We have ordered leaflets for all the pharmacies, for all the general GPs in City and Hackney, and also from A&E in Homerton. I'm informed they have been delivered, but Homerton tells me they haven't got their supply, so I'm following up at this moment. So yes, if it's not already in pharmacies, it will be shortly.
Okay, thanks, Rosalia.
But Jen, if you can
Yes.
share the full slide, the full presentation with me, obviously,
Yes.
I can definitely send it to everyone.
Could you just, sorry, Kanari, can I ask one more clarification? The slide now we are looking at, all the health conditions on the right-hand side, like diarrhea, headache, thrush, constipation. Are you saying that people will have, if they are on benefit, universal credit or any other benefit, can they access to these services or medicine free of charge from the Health First pharmacy? Is it what you said, or I misunderstood?
Yes, so under this Health First pharmacy scheme, you could go to your community pharmacy and check that you fitted into one of these criteria in the white panel. And then that would mean if you had one of the conditions that are listed on the right here, and you spoke to your pharmacy and said, for example, I have constipation, when they spoke to you and gave you advice, if they recommended to you a particular medicine to buy, and if that meant that you were eligible in the scheme according to this list, then they would be able to give you that medication free on the NHS.
Okay, can I thank you? Is for example, patients with diabetes or cancer, they are having treatment, can they have access to these? I don't know if they're on, I assume they're on some kind of benefit, but which one I wouldn't know.
Jennifer, do you want to add on to that?
Yes, please.
Here. So, Gulna, so if patients present at the pharmacy and they have a current condition on the right, they can access some medicine. So, for example, if I turned up and I had constipation, but but I wanted a specific product, for example, I may not be able to access that. But we have an agreed list of medicines where a patient who has a current condition, so I also couldn't request something that I may need in future. So I couldn't say, I know I usually get constipation, so can I get some and put it in the cupboard tablets? I couldn't. I need to have a current condition. I need to be appropriate for that medicine. So the pharmacist can check and say, if you have cancer, maybe it's not appropriate that I treat you for constipation over the counter, so I'll send you back to the GP. What this scheme does, it makes it available for the usual scenario, but there may be instances where for other conditions that a patient has, the pharmacist may need to send the patient back to their GP. But if all else is equal, so, you know, if there's not any sort of conflicting conditions, etc., that the pharmacist is worried about, and the patient does have eligibility through the benefits listed on the left, then yes, they can access these medicines.
Okay, yeah, thank you. Great.
Thanks.
Okay.
Could I ask a question? We're Brexiting on the 1st of January, and I just wonder whether that's going to have an impact on the availability of medicines.
Jen, do you want me to answer that?
Yes, please.
Potentially, yes. We don't know for sure. But the government has taken steps to do things like stockpile, ask manufacturers to stockpile more medicines than they normally would. So normally manufacturers and wholesalers will keep a certain stock of medicines, but the NHS asks them to stock up a little bit more as well. But we all have a role to play, and Jennifer talked about this earlier. So for example, as patients and residents, some of the things we could do to ensure that we don't have stock supply issues would be not asking our GPs for more medicines than we would normally have. So if I normally get a month's supply of a medicine, then I should request a month's supply, not 2, not 3 months supply. And also ensuring that we order in sufficient time, but not too far ahead, because those things bring in supply issue problems. If lots of patients are asking for their prescriptions to be a longer duration, or for the prescription to be brought forward earlier than usual. So we all have a role to play to ensure that we maintain the supply systems and chains. The government's done their bit in asking manufacturers of and wholesalers of prescribed medicines to hold larger stocks, and in terms of ports, which ports would be open, etc., to ensure supplies. But as residents and patients and citizens, we also should do our bit, and that would ensure that we don't have problems. But I want to also say to everyone, from time to time, there is always a supply problem with a certain medicine because of all sorts of things. But we get notification from the Department of Health on this, and we advise GPs about what to do with regards to those issues. So it's not new to have supply problems. It doesn't happen often, but it can happen. Thank you.
Thanks, Rosalia. Fingers crossed.
Yes. Thank you. Is there your presentation finished, Jen?
Yes.
Rosalia, sorry.
Sorry, can I ask one more question if no one else asking in this minute?
Yeah, sure, go on, Gulnar.
Okay, yeah, from last year, I remember one of our service users was running out of her medication, and she contacted her, I think, pharmacy initially, but she couldn't have it, and she was panicking it will finish soon. She's a kidney patient, kidney sufferer. And I realized that it was coming from the hospital. What is the complication in this? If the medicines are directly coming from hospital, actually, are they physically coming from hospital to patient's home, or is it to pharmacy first, then to patient? In order to prevent this panicking, what the patient needs to be doing, and what is the process actually?
Jen, do you want me to chip into it as well? But please do add.
No, yes.
There are medicines that are agreed between the hospital and primary care, so in GPs, that those medicines are safer to be prescribed by the hospital. So in this instance, patients would typically would go back to the hospital, and either they'll physically get a supply from the hospital, or sometimes the hospital can give a prescription to the patient, and the patient has it dispensed in their community pharmacy. It depends on the nature of the drug, but usually these decisions are made for drugs which are considered to be more specialist, and therefore the prescribing and monitoring of these drugs is better done in the hospital setting. The patient should have been advised about the manner in which they'll get their medicines. So pre-COVID, usually the patient would pick up the supply at the hospital or get a prescription at the hospital to have it dispensed. However, during COVID times, when hospitals are also looking at which patients coming and the need to come in, some of the outpatient clinics are running remotely. And in those instances, the consultant at the hospital could prescribe the medicine and the hospital would arrange transport to the patient. So this is during the COVID period. So I'm sorry I haven't given you a specific answer for your colleague's scenario, but it depends on whether it was during COVID or outside COVID, whether they had a virtual outpatient clinic or not. And so it might slightly differ. But the reasons are usually because some drugs are more safely prescribed by the renal specialist, for example, in the hospital setting. I hope the issue she had has been resolved. But if you had any further concerns about her or a similar patient, I'm sure if you drop in an email to Catherine and her team, they could forward it on to us to look into, so long as it's a patient who has a City and Hackney GP.
Yeah, it was during the It was during the COVID pandemic. It was in March or April, those months. She was really panicking. She couldn't get her medication in time. Yeah.
And in such instances, also encourage the person to contact their practice and ask. Some practices employ their own practice pharmacist. So if the GP is not to hand, or it might even be preferable to ask for the practice pharmacist or the GP and say, you know, I normally take this medicine, I normally get it from the hospital, I don't know what's happening with it, because it might be easier for the GP practice to contact the hospital team and say, what are the arrangements?
Okay. Yeah, thank you.
Excellent. Thank you very much. Did you have a question?
I have.
Please,
yeah, two questions actually. With the pneumococcal vaccine, is that an annual vaccine or is it every few years? And my second question is, there has been some problems recently about lithium, the drug is used for people with mental health problems. There's been threats of withdrawal from the market, and I just wondered what the current situation was.
Sorry, Jen, carry on with the pneumococcal.
Okay, I was going to say about the lithium. I know.
All right.
Well, the pneumococcal, I believe it's yearly. Rosalia, can you confirm that?
No, I think it's either every 10 years or a one-off, depending on patient groups.
Okay.
Yes. It's definitely not a yearly. It'll be 10 years or a one-off. I'll need to check. But it's definitely not a yearly.
Definitely not yearly. Okay, thank you.
And the lithium, and the lithium, you're right, Malcolm. So the manufacturer of one of the lithium brands, Priadel, there are a number of brands, not many, I think about 2 or 3 other brands, but the most commonly used one, Priadel, the manufacturer, I think there was a plan by the manufacturer that it would be withdrawn, that brand would be withdrawn. So we started to do some work with our local mental health trust, on a local level, but also nationally, to look at how patients on Priadel, this brand of lithium, would be managed. However, a lot of my colleagues also raised some pressure with the Department of Health, that this move was probably not very welcome, etc., and questioning the reasons behind it. So at the moment, there is no plans of withdrawing Priadel. The Department of Health is working with the manufacturer of Priadel, and there is no withdrawal of this product imminent. So it's not necessarily a permanent decision, but at least for the year coming, there will be no withdrawal of Pride-L.
Okay, thank you very much.
You're welcome.
Thank you. Thank you very much. If there are no further questions to Jen or Rosalia, I will then ask Clara Rutter, the program lead for urgent care in City and Hackney.
Hi, everyone. Apologies, I'm joining from my phone and I don't have a camera. So yes, I thought it would be helpful maybe if I just clarified what the out of hours period is. So we typically define that as 8 p.m. on a Friday night until 8 a.m. on the following Monday. So throughout the weekend, the Saturday and Sunday, it's a 24-hour period. And then on all public holidays, it's also a 24-hour period. So if we take Christmas, which is coming up, for example, Christmas 8 p.m. on the 24th, out of hours will commence and it will last all of Christmas Day, the 25th, which is a Friday, all of Saturday, all of Sunday, and then I believe this year the Boxing Day substitute day is actually Monday the 28th, so all of Monday, and then 8 a.m. on Tuesday morning, normal service will resume. So for the Christmas period, it's sort of quite a few days in a row. So I'm just going to talk about how you can access primary care services in this period. So if you have a routine condition that you normally see your GP for, there are appointments that your GP can access now and book you into via our extended access hubs. So these are routine appointments. For example, if you've got an eczema flare up, or if you've got, I don't know, joint or limb pain, for example, and your GP knows that you've got a condition. Well, now I say now, it's a month in advance. It's probably a bit too early, but I don't know, maybe a week before that Christmas period. If jointly you've identified a problem and you agree that an appointment is required during that period, there are appointments available that your GP can book into ahead of time. If you develop a condition that you didn't previously have before the holiday period, so you suddenly feel poorly or sick, you can still access primary care services. You don't have to go to A&E, and you shouldn't go to A&E if it's a primary care problem, and you can access these services via 111. So if you phone 111, they'll ask you a series of questions, they'll help triage you, and they will also help to identify whether a primary care clinician is best to see you, and they will be able to book you into an appointment in this out of hours period. There's two places they can book you into. One of them is in our out of hours service, which is located in the Homerton Hospital. It's not a hospital service, it's a primary care facility that is run in the Homerton. We've commissioned the Homerton to run this service. Another location is in the community, in an existing GP practice, and we're currently just confirming exactly where in the community this will be. It's possible that you can talk to the 111 provider if you have a preference for either site. I mean, the care you receive will be the same. It'll be a primary care clinician seeing you. But if you have a preference, you can certainly ask 111 if there's an appointment available at the GP out of hour service in the Homerton or in the community. And they should be able to look up in the system to see whether there are appointments available. There may be limitations to where you can be seen based on when there are appointments available and how urgently you need to be seen. So for example, if you've got an urgent problem that needs to be seen within 2 hours, and the only place that has an appointment available within the next 2 hours is in the community, then it's likely that that's where you're going to get an appointment. Yeah, I hope that makes sense. So I think I've covered everything I wanted to. Sorry, one thing I should clarify: the appointments in the community don't run 24 hours a day in the out of hours period. They run from 8 a.m. to 8 p.m. So from 8 p.m. on Christmas Day or the Saturday or the Sunday or the Monday, the out of hours service at the Homerton absorbs all of the activity. So at that stage, if you phoned up 111, you wouldn't necessarily have a choice of being seen in a community location because they wouldn't be open.
Right.
Does any have any questions
Yes,
or
just
anything
very
that I can
quickly.
clarify?
Yes, just very quickly. You said that you still don't know where in the community these services will be available. So there is service that is provided within Homerton Hospital, but you're still clarifying where in the community as well will be provided. So when do you think you will get this information? And will that be publicly available?
Will it be publicly available? So I'm not sure when that information will be available, to be perfectly honest with you. I know that the GP Confederation was speaking to all the GP practices to identify a suitable location. So I can follow up with them to find out when they think they'll have that confirmed. Right. And then in terms of whether it's publicly available, I'm not sure. I mean, it's certainly not going to be hidden information, but I don't think it's going to be advertised because right. Like all of our GP practices now, all of the appointments, regardless of whether they're at the Homerton or in the community, the first thing they'll do is speak to you over the phone. And then you will jointly decide whether you need to come in for a physical face-to-face visit. So again, I'll clarify with the Confed as to when they'll have that decision made and whether that's something that they typically make publicly available.
Right. So I would really recommend if anyone has any concerns for them to ring 111 first before they actually
Absolutely. 111 is the access route. Yeah. So you wouldn't be able to just walk into the Homerton right. and say, oh, I'd like to see the GP service. You need to access these appointments via 111. The first thing that the GP will do is phone you so that you can have a telephone chat and then jointly decide whether they can actually if it is medication that you need, if they can prescribe the medication over the phone. It's possible that they'll offer you a video appointment, and only if you definitely need a face-to-face appointment will they then bring you in for a face-to-face appointment. So yeah, 111 is absolutely the way to access all primary care in this out of hours period.
Thank you. And just to clarify one more thing, the out of hours, the one that you said starts from 8 p.m. and runs until 8 a.m. in the morning. So this is not only available during the festive period, but this is how they run in general, isn't it?
That's correct. So all weekends, so come Friday, this Friday, from 8 p.m. this Friday, the out of hours period starts, and then it'll run all of Saturday, all of Sunday, and then 8 a.m. on Monday morning, we resume normal in hours.
Excellent. All right. Thank you very much, Clara. Any questions for Clara so far? No?
Me.
Go on, Gilner.
Yeah, thank you for that. Can we have this information a little written format so you can share it and then we share with our service users? And also about the vaccination, I can't pronounce that vaccine. Can we have that who is eligible, like babies? And I have read
yes, in the chat box. Yes.
But can you please send us as a little in the email who is eligible and when?
Okay, I'll include that in my email to everyone who is in attendance today.
Yeah, thank you. I couldn't really, I think I missed out. This out of GP normal hours, is it only for during this lockdown period or is it for all the time? And also during the festive season?
No, it's a service that we've had for many years. It's always been available. The difference is prior to COVID, 111 may have booked you into a face-to-face appointment right away, whereas now the protocol is that the GP will phone you back and speak to you over the phone and only bring you in if it's absolutely necessary, if they deem it absolutely necessary. So that's the only thing that's changed since COVID.
Right.
Okay. All right. Thanks.
Okay. And I'll communicate with you, Clara, at the end of the meeting, just to see if you can, put your verbal presentation into paper that I can share it with.
Absolutely. Happy to do so.
Thank you. That would be really good. Very useful. Thank you. I think we've got very, very useful information from the speakers today, for which thank you very much, everyone. Any further questions for Clara or for Jen and Rosalia, perhaps, on pharmacies?
Canary, yes, sorry.
Yes.
I wanted to say, is it worth, I know Jen's put it in the chat, but for the purposes of the recording, just to clarify the pneumococcal vaccine verbally as well, because some people may not get access to the chat box. Jen, do you mind? Jennifer, needing unmuting.
Yeah, now I'm unmuted, sorry. So for people age 65 or over, you only need a single pneumococcal vaccination. But if you have a long-term health condition, you may need just the one, or you may need to have it repeatedly every 5 years. And then there's information about, so babies receive it at birth as well. So there was some information about that.
Excellent.
So
Thank you.
Once or every 5 years.
Thank you, Jen. And I think Bissy has a question to ask. You're muted. Yeah, you should unmute yourself, Bissy. Just have to press the. Okay,
yeah, thank you.
You are on now.
My question is, my pharmacists, they are really good helping me. And I'm from the Lower Clapton Health Center. That's where my doctor is. Every time they phone for a prescription for me, it's declined. And when I'm seriously ill, the consultant for my shoulder phoned me for my shoulder problem. He noticed and he said, why is your doctor not calling you? Why are they not giving you this and that and that? Then I did phone in and I had a series of nasty questions being asked by my doctor. Then I went to the pharmacist. He was shocked and he phoned, he said the same thing they did. I put it down, but they did not give me. So I was sick again the following week and I couldn't do anything. I insisted. Then I said, I had this because of my illness. If you look through my file, apparently she has not read my file. And the pharmacist said to me to tell them to send my repeated prescription. She still did not. So then I reminded them again. I said, I phoned in and I'm still waiting. Are they still phoning me back? And the lady said, oh, they'll phone you. I don't know which doctor. When she did phone me, it was the same doctor that affected me like that. And she wasn't interested. Then I said to her, I said, do you know something? I needed this. And can I remind you, my prescription is supposed to be on the 22nd. And when I phoned, and the consultant and the pharmacist knew that I needed all this and all that, you still said no. Then unfortunately for her, she said, oh, then I have to remind her what the hospital consultant did for me 2 years ago. Then I said there was no follow-up. So who said that? I said, I know, because I gave you the information. You said you didn't have the information from the hospital. It's in internet and you haven't got it. And I've got a copy because I always know your reputation. So they always give me a copy before I leave the hospital. So to cut the long story short, it's really difficult to get appointment. Different doctors you are saying, you never have a particular doctor who is interested, who knows you. Then I always say to them, why don't you go and ask Dr. Heighton or Dr. Bick? They know my history since 1976 from that surgery. So you should be able to not just judge me and everything. And that's why she said, oh, you haven't, by the way, you haven't done any blood tests from February. And then I will let you come in. Then she texts me. So I'm going today to see her. That's so good. I just don't know what is happening with national health doctors.
So BC, were you saying that it was, did you say that your community pharmacy requested it from the GP practice and it was declined?
Every time, even the prescription that they couldn't get anymore, probably because of the E something rule, they gave me, they told me the name. I took it to the surgery before the lockdown. They phoned again, they were refused. So on
Yeah.
emergency, one of them gave me, the next one didn't want to give me. So I said, what is going on?
So they should, if a repeat medication request is declined, then some information should be given to you about why that was declined, so that you can understand what's going on.
The chemist was saying they are busy, they are just removing your essential prescription. I said, I know, you know, so
if you're going for bloods today, that's good. And I recommend maybe you ask to speak to the practice manager and just tell them what happened today.
Thank you.
Rosalia, have you got anything to add to that?
I was going to suggest the same. It seems medicine is one issue, but it seems that there is other issues wider than medicines. And I think the best way of doing this is probably just putting in writing with some dates of when things happened, and writing to the practice manager and saying that you have some concerns about your care, including medicines, including accessing your past medical history and all of that stuff, and that you would like to maybe have a virtual meeting or a discussion with her, and a response in writing from her as to what the issues are, so that you can try and get to the bottom of it, because otherwise it seems you might be getting repeated issues coming up with.
That's why I said I've got so much, but the pharmacist is always good, and he advised me don't go to alternative medicine. I said the consultant tell me the same, and I don't.
But write to the practice manager, contact the practice manager in writing, cataloging what the issues are, and then say to her that you would like to have a conversation with her. And then maybe once you've had a conversation, she summarizes, how things are going to change to meet your needs and the practice's needs as well. I think that's probably the best way to do it. But if you have medicine-specific issues, it's good you liaise with your community pharmacist. But if you feel that you still have issues, if you contact Catherine or her colleague in Health Watch, we can help to see how we can support that. But it seems your issue is not just about medicines; it's a bit wider than just a issue.
And I guess this was what you wanted to talk about, Bessie. So I'll wait for your email or for you to get in touch with us when you're ready. Excellent. Or if you need any further information on what to do next.
Thank you for that information.
All right. Thank you. So it's almost 2 o'clock now. We have another 4 minutes to go. But if there are no more questions for Jen, for Rosalia, or for Clara, I'll just close the meeting. Any more questions? Gülnur? You're muted. Okay, you are on mute, Gülnur.
Sorry. This flu vaccine and the other vaccine I can't pronounce. Is it meningitis vaccine? Kind of. Could it be taken near to each other, or there needs to be a gap between some days or months? Could you clarify?
Can we come back to you?
Okay.
I think it's probably better if we come back to you about if there's any recommendations.
Is there any side effects on old age people with the health condition like heart or diabetes, or what else? Cancer patient, can they take this or not? Would be great if you can.
We'll try and summarize who can and can't have it, but typically flu and pneumococcal, and those are the conditions that if you have long-term conditions, I'm not including cancer in that, but usually things like diabetes and heart conditions, that you're encouraged to have vaccination, because the benefits outweigh any sort of side effects. But what we can do in the response is maybe just summarize who's eligible, who perhaps should not have it, but just be assured that if you shouldn't have a vaccination, your GP will have the relevant records to know that you're not eligible for the vaccine, if that makes sense. So the GP will have that check in place to make sure you can't access it, the vaccine. And even if you're accessing it through your pharmacy, they would also have some access to your summary care records to know, if you're eligible or you're not eligible. Because you can have these vaccines in your community pharmacy as well.
Okay, quick question came to my mind again. If anyone had tested COVID positive, can they have this new vaccines?
Good
Not the
question.
COVID vaccine, not the COVID vaccine, but the pneumonia. No.
Cocoa vaccine.
Yeah, that vaccine and the flu vaccine.
Well, during your COVID infection, you're not going to be vaccinated for flu, etc. But there is, so I suppose is your question, if you've had COVID in the past, can you have these vaccinations, is what you're saying?
Yeah, yeah.
As far as I know, yes. If you have the current condition, so you have the illness now, then no one's going to be vaccinating you at that period of time.
Yeah. Okay, great.
Excellent.
Thank you.
Okay, all right. Well, thank you very much, everyone, for joining. It was really good, productive meeting. Lots of useful information shared, and hopefully very soon I'll be able to pass it on to everyone else and have it on our YouTube channel as well. And if you don't have any further questions, thank you very much. By the way, just to let you know that our next information exchange meeting will be on 15th of December, and we'll be talking about mental health services during COVID-19 and during the festive period as well. So please feel free to join in. Okay.
Thank you.
Thank you very much, everyone. Have a good
Bye.
afternoon. Bye-bye.
Thank you.
Bye. Bye.